Hello everyone, this is Aishwarya Kumar from IPASF Pune. I'll shortly introduce you what is IPSF. So IPSF is a bunch of pharmacy students who share awareness in the community related to healthcare and pharmacists. So we have here with us uh, two renowned doctors of physiotherapy from Pune. So we have Dr. Saurabh Deshmukh sir, who is a sports physiotherapist and also a physio consultant at uh, Kridakul, and is also a founder and director of Aayurphysio Wellness Center, Pradikaran.
Hello, myself Osama Momin. I am social media office head. So here with us, Dr. Amruta Potdar. She is currently working in Aayurphysio Wellness Center, Pradikaran, and she was ex-HOD physiotherapist at Sancheti Hospital, Pune. वेलकम सर, वेलकम मैम. सर, जैसे कि फिजियोथेरेपिस्ट आपका जो प्रोफेशन है हम लोग से काफ़ी अलग है, बट आपके बिना हम लोग का मेडिकल जो लाइन है वो पूरा चलता नहीं है. सो सर, आपको मैम आपको ऐसा क्या चीज़ मीन्स मोटिवेट करता है जिससे आप फिजियोथेरेपी वर्क बहुत इन्जॉय करते हैं?
थैंक यू वेरी मच. सबसे पहले मैं बोलना चाहता हूँ कि मुझे यहाँ पे आपने इनवाइट किया. सो इट्स अ गुड इनिशिएटिव फ्रॉम यू गाइज कि वर्ल्ड फिजियोथेरेपी डे के दिन आप फार्मेसी रिलेटेड होके यू आर ट्राइंग टू हम लोग को आप मोटिवेट कर रहे हो, हर फिजियोथेरेपिस्ट को मोटिवेट कर रहे हो, एंड यू आर ट्राइंग टू गिव ऑडियंस what exactly physiotherapy is and what exactly physiotherapists do, right? So first of all, thank you for this. Yes.
Thank you so much for inviting both of us over here. So coming to the question about what motivates us, so basically healing the patients, treating the patients, making them pain-free, helping them in doing their activities of daily living with ease is something what motivates us and encourages us to work as physiotherapists. And you would like to add on?
So सबसे important thing is we are staying in a community, we are staying in a society. So there is something that we want to give the society back, right? So through physiotherapy, we are trying to help people to get back to normal lives. We are trying to build athletes for better and better future. We are trying to help kids to select what sports they want, or maybe the best thing will be if our society becomes any disease-free society. So for that, we are trying to help people through exercises, through proper diet plans and everything. So I think that thing motivates us to help and to keep on working in this field.
Thank you so much, sir. So, adding to your line that you said ki you are doing everything for the society. So, what is that one positive impact or that one positive thing that you find in physiotherapy?
So basically physiotherapy is we treat patients without using any medication. So I think
It is itself called as a non-pharmacological treatment.
Inculcating good daily habits, daily routine habits, inculcating good exercise habits in every individual, or for instance, the patients we get here. So inculcating these good habits, exercise habits in these patients, definitely going to make a long-term impact in their health. Our main motive is to make them injury free, to heal their injuries, and वो injuries वापस नहीं होने चाहिए, and their daily activities or daily routine should be on a normal and easy way में होना चाहिए. So that's how we are planning. So that's what motivates us again.
Sir, adding to your healing, that healing the patient motivates you. Sir, can you give the case that is very very much means everyone has that case जो बहुत ही इम्पोर्टेंट रहता है लाइफ में या उससे कुछ सीखा रहता है, जहाँ पे ऐसा हो सकता है कि पेशेंट्स का कोई होप ही नहीं है बट आप लोग ने उसको वापस होप दिलाया हो, ऐसा कोई केस होगा सर आपका?
There are
There are
some
quite a
cases,
few, quite a few.
some cases where we think we have done a good job that getting that patient back to normal. So I think, but it was just a job that we did everything through process, and the end result was good. So patient was happy. Patient was able to get to his normal routine very fast. So the first instance I would like to note is I have worked with many international level athletes as well as national level athletes. But this case is he's an amateur athlete. He is amateur runner. So he had planned to run Ironman. So they have running, swimming, and cycling event in one day. Okay. So he had planned this for last 6-7 months. He was working for that rigorously, very sincerely. But I think before that event, 1.5 months back, I think, or 2 months back, he twisted his ankle, and it was very easy that okay, it's just an ankle sprain. But we had asked him to go for a X-ray, and X-ray showed there is a fracture. I think he was totally shattered because he was working for this for 6-8 months and everything was at stake, and he wanted to get back to normal and run that event. Somehow with physiotherapy treatment and with physiotherapy protocols, exercise protocols, the sincerely he took physiotherapy treatments, everything went well, and he was able to run and finish the event, and he was so happy that okay, then we thought okay, we did great job after when we finished the event properly.
We have like not very there are quite a few success stories, but something which I remember is there was a 19-20-year-old girl who was traveling and she met with an accident and she got paralysis down the legs. Okay, so her nothing was working from below the back, right? So we worked a lot on her, and we could at least get her back on her feet within 3 months and get her walking with the help of a walker. And we had planned a marathon, walkathon rather, and she walked in that walkathon. So that was an achievement.
One more incident I would like to tell, because it's not about us, it's about physiotherapy. So I work in a kabaddi league, okay, where I don't want to take names right now, but because I don't know about legalities. But one player got injured, which was like he was the main raider, okay, and if he could play, definitely we were able to win the games. Luckily, he got good support, good treatment, because the thing is, many doctors we visited for him, he got twisted his knee. So many doctors we visited and everybody was like, उनका आप सर्जरी करो तो ही वो खेल पाएंगे वापस, और ये सीजन में तो वो नहीं खेल पाएंगे. But with proper physiotherapy treatment and proper care, he only missed 6 or 7 matches out of 22 matches. He could play, and the best thing was we won that championship in that year. So there are many factors surrounded for that player, because he was one of the best India player also. So full Indian coaches, all Indian coaches, Indian teams were looking after him. कि क्या कर रहा है, ये कैसे कर रहा है. And now I think he will be able to play in upcoming Asian Games also.
Ma'am, as we are a pharmacist forum, one question came from our community. How do you think a collaborative approach between pharmacist and physiotherapist benefit patients undergoing therapy and medication regimen? And also, how do you see the collaboration between pharmacist and physiotherapist evolving in the future to provide even better patient care?
So, a collaborative approach between a pharmacist and a physiotherapist is required in many different conditions. So, we have got different conditions which are inflammatory, like, for example, rheumatoid arthritis or inflammatory arthritis, or a lot of systemic issues where we need support from medicines. And only physiotherapy is not going to help. Physiotherapy is going to work, but along with the medicines.
I think everything goes hands in hand, because, for example, where I work right now in a clinic, physiotherapy clinic, where there we also use integrated approach. Okay, so it's never going to be only physiotherapy which is going to help patient. Okay, it's a collaborative approach. So whether it is a pharmacist, whether it is an orthopedic surgeon, whether it is a neurosurgeon, or whether it is a Ayurvedic practitioner or a nutritionist or a strength and conditioning coach. So it's a collaborative approach for patient, and patients get satisfied. Patients get a proper 360-degree view of a treatment through this approach. So I feel everybody and pharmacists are very, very important, so that patient gets back to normal.
Okay, so as you told that it's a collaborative approach. So like there's a one question like are any there common medications that the patients are undergoing when they're undergoing physiotherapy? Are there any common medications which are used? And these medications are like used therapeutically?
There is a concept in physiotherapy called phonophoresis, where we use ultrasonic rays, and this concept, and through ultrasonic rays, we try to pass some medication through the skin. Okay, so this we use to treat some inflammatory conditions, or for example, tennis elbow, heel spurs. Yes. So in these conditions, we use anti-inflammatory medications and ultrasound together.
Those are in the form of the tubes and gels which we use. So along with that, we use the gel, normal gel, ultrasonic gel, and the medicated gel, and then we use it for the treatment.
So that is called phonophoresis, and we use it very often.
So yeah, and that works.
So patients sometimes come with patient ने पहले से लिया रहता है कुछ anti-inflammatory medicines, and so we as a physiotherapist, we don't ask them to change whatever they are undergoing treatment from earlier or before. So मैं तो हमेशा बोलता हूँ पेशेंट को कि आपका जो ट्रीटमेंट चल रहा है वो कंटिन्यू रखो, आप वो डॉक्टर से बात करो, एंड देन यू डिसाइड वेदर यू वांट टू stop that medication or not. But from our side, we don't use any medication for this.
सर आपका जैसा था कि आप मेडिकेशन चेंज करने नहीं बोलते हो, बट कई बार ऐसा होता होगा कि आपकी थेरेपी में हिंडरेंस क्रिएट करता होगा कोई मेडिकेशन.
एक्चुअली मेडिकेशन बंद करना ऐसे नहीं बोलता हूँ मैं. सो जो आपका डोसेज है अभी, हाँ, वो एटलीस्ट कंप्लीट करो. ओके, बिकॉज वो डोसेज भी आपको किसी एक्सपर्ट ने दिया है, राइट. सो किसी भी एक्सपर्ट के काम में आप अपनी टांग नहीं अड़ा सकते. सो दैट्स व्हाट वी फील. सो वी आस्क देम टू, आपको जितना 5 दिन का कोर्स है, 7 दिन का कोर्स है, सो वो कंप्लीट करो आप. ओके, देन वी सिट अगेन टुगेदर, एंड देन वी डिस्कस अबाउट द प्रोग्नोसिस, एंड देन ओनली आई समटाइम टेल पेशेंट कि अभी आप 5 दिन दवाई मत लो, एंड देन वी आर डूइंग फिजियोथेरेपी ट्रीटमेंट, एंड देन विल सी कि कितना फ़र्क आपको इमीडिएटली पड़ता है. ठीक है, एंड इट हेल्प्स, डेफिनेटली हेल्प्स. बट द मेन थिंग इज वी डोंट आस्क पेशेंट्स टू चेंज मेडिकेशन और स्टॉप मेडिकेशंस अगर किसी एक्सपर्ट ने पहले से बोला है तो.
So it does not really create a hindrance. So it is basically, it should be helping ideally, okay, to the patient to get fit better and easier and quicker. But like sir said, after the required dose is complete, and if the patient, basically the patient's first complaint is always pain, and movement is difficulty in movement is something which comes second. First complaint is always pain, so we need medication. The patient is taking medications for pain relief, but after the course is completed and if the pain does not persist, then we definitely would advise that to stop the pain medications and continue with the rehab, continue with the exercises.
Ma'am, there was one more question from our community. Continuing on the collaboration of medication and physiotherapy, how do you navigate potential interaction between medication and exercise routines? And to add on this point only, there are certain supplements and vitamins that could complement in your treatment plan. Are there any?
The answer is yes, because sometimes we ask patients to take vitamin D supplements, fish oils, because these all can help to reduce the pain. Okay, can help in some nerve-related conditions. Okay, so we ask patients to take these medications through any physician.
Because the deficiency of these vitamins may be one of the major cause why the patient is having those muscular kind of pains.
So after the event of Neeraj Chopra, so there is one question. Like all the new youngsters and everyone is motivated towards sports and everything. So like from a physiotherapist point of view, like what are the preventions that you would suggest to them?
This is my favorite topic, uh, sports related physiotherapy. Yes, actually this is happening right now, that after Neeraj Chopra's heroics in Olympics, in World Championship, now parents are getting involved in that. Parent want their kid to play some sport. Okay, and when we consider, okay, वो जैसे अंधे की तरह मेरे बच्चे को इसमें डालो, उसमें डालो, इसमें अच्छा खेल रहा है क्या, उसमें अच्छा खेल रहा है क्या, ऐसा हो सकता है। और उसकी वजह से बहुत सारे कंप्लेंट्स लेके बच्चे आ रहे हैं, जैसे किसी का टेंडनाइटिस हो रहा है, किसी को टीबियल ट्यूबरसिटी में स्वेलिंग आ रहा है, किसी को ओवर यूज़ की वजह से एल्बो में पेन आ रहा है या शोल्डर में पेन आ रहा है। ये सब प्रिवेंट होने के लिए यू शुड ऑलवेज टेक एक्सपर्ट्स हेल्प, फर्स्ट थिंग। इसमें बहुत सारी चीज़ें, जैसे मेरा बच्चा है, मुझे कौन से खेल में उसको रुचि है और कौन से खेल वो खेल सकता है, इसके लिए भी देर आर एक्सपर्ट, दे आर एबल टू डिसाइड कि मुझे, मेरा बच्चा थ्रोइंग इवेंट कर सकता है, या मेरा बच्चा रनिंग इवेंट कर सकता है, या हैंड आई कोऑर्डिनेशन वाले इवेंट्स कर सकता है, जैसे आर्चरी है, शूटिंग है, या टीम स्पोर्ट्स खेल सकता है। एंड देन स्लोली यू कैन बिल्ड ऑन दैट। सो अगर आपने गेम सिलेक्ट किया, देन यू कैन बिल्ड ऑन, अच्छे कोचेस के पास जाओ, वो भी अंधाधुन ट्रेनिंग नहीं करवाना चाहिए। उन्होंने भी प्रॉपरली ट्रेनिंग का एक पैटर्न रहना चाहिए, उसमें वेरिएशंस होने चाहिए, उसमें पीरियडाइजेशन होना चाहिए, थोड़ा साइंटिफिकली ट्रेन होना चाहिए बच्चा जब आपका 6 या 7 साल का है तब से। ठीक है, इट्स नॉट के 13 साल तक उसको कैसे भी कोचिंग चल रहा है या कैसे भी खेल रहे हैं वो, और उसके बाद उसका प्रॉपर साइंटिफिक कोचिंग हो रहा है, ऐसे नहीं है। सो इट शुड स्टार्ट फ्रॉम द ग्रास रूट्स, इट शुड स्टार्ट फ्रॉम द स्क्रैच। 6 और 7 ईयर ओल्ड से ही उनका कोचिंग साइंटिफिकली होना चाहिए, ताकि यू विल गेट अ बेटर स्पोर्ट्स पर्सन या अ बेटर और फिट ह्यूमन बीइंग।
Sir and ma'am, basically the physiotherapy is concerned with only physical health. But one question is there, does it also affect our mental health? Or there are any techniques that can help in mental health by physiotherapy?
Yes. Basically, when does a patient need physiotherapy? When the patient has pain or has difficulty in doing the activities of daily living. So when you have these difficulties, the mental health is going to get affected to some extent. Because, for example, let us consider a patient who is paralysis, hemi, and he suddenly stopped doing all the activities of daily living. He has become fully dependent on someone else. So his mental health is going to affect a lot. So in that case, along with physiotherapy, like physiotherapy is going to help them get back at least some activities of daily living on his own. So in some way or the other, like talking to a physiotherapist, working on those activities and getting the patient doing the activities of daily living is going to help get the mental health little bit better than what it was. So it definitely helps with the mental health. This is just an example of hemiplegia, but then there are many other patients who have, like for example, frozen shoulder. The patient is not able to lift the hand up, and if you consider a woman doing that, who has to do all the kitchen work with the hand, and she's not able to do that, so it is going to affect her mental status. So if we work on her pain, if we work on her movement, and if she's able to do all the activities, then we are improving her mental health as well.
Right. Just to add in this, so there are patients. हमारे इधर बहुत सारे patients आते हैं वो जो बैक पेन लेके आ रहे हैं या नेक पेन लेके आ रहे हैं, और पेशेंट आते ही हम लोग को समझ में आ रहा है कि अरे इसका वज़न ज़्यादा है, इसका पेट आगे आया है. सो द थिंग इज़ उसकी वजह से उसका बैक पेन हो रहा है, नेक पेन हो रहा है, या ओवर वेट की वजह से नी पेन हो रहा है. एंड द थिंग व्हाट हैपन्स इज़ बाकी के सोशल रीजंस और इसकी वजह से उस पर काम पे असर होना स्टार्ट हो जाता है. एंड देन पेशेंट गोज़ इन स्लोली डिप्रेशन में जा रहा है, या काम के उधर बहुत तकलीफ हो रही है, देन घर पे झगड़ा कर रहा है, वो सब वहाँ का निकाल के गुस्सा घर पे डाल रहा है. एंड दैट मेंटल हेल्थ इज डिस्टर्बिंग उनका और उनके घर वालों का. सो द बेसिक रीज़न आपका बैक पेन, नी पेन या नेक पेन है जो है वो तो ख़त्म हो जाएगा, बट आपका वज़न भी कम करना है. सो फॉर दैट ऑल्सो फिजियोथेरेपिस्ट हेल्प टू मेक अ प्लान. उनको अच्छा सा प्लान बना के देखे, देन उनका अगर वेट थोड़ा थोड़ा कम हो जाएगा, देन ऑटोमेटिकली ये सब चीज़ें कम हो जाएगी. देन उनका जो मेंटल इश्यूज हो रहे हैं वो भी स्लोली कम होना स्टार्ट हो जाएंगे. सो इट इज़ इंटरमिंगल्ड, थोड़ा सा एक दूसरे के ऊपर डिपेंड है. आप एक्सरसाइज करो, आप अच्छा प्लान करके एक्सरसाइज करो, तो स्लोली आपकी बाकी की चीज़ें भी ईज हो जाएंगी. तो ऑब्वियसली मेंटल हेल्थ विल डेफिनेटली गोइंग टू इम्प्रूव. Yes.
And vice versa also, even if increase in mental health, or so rather decrease in mental health or increase in the mental stress also increases the pain. So it is vice versa also. So we need to work both ways.
Yeah, so as my father always says that do exercises and then you will be healthier, but we don't follow. Okay, fine. Coming to the last question. So like what are some of the common misconceptions that people have related to physiotherapy that you would like to clear?
सबसे पहला फर्स्ट चीज़, ये तो मसाजर है या ये मसाज करते हैं, ठीक है. सो दैट इज़
one major misconception.
major
Physiotherapy is
misconception. I think physiotherapy is not only massage. It has vast scope of work, whether we use some electrotherapeutic modalities, we use exercise regimens, we use some manipulation techniques, we use dry needling techniques. So there are many techniques we use in orthopedic physiotherapy. She will be able to explain more about neurological physiotherapy related approaches.
People who know somewhat about physiotherapy also have is physiotherapy is all regarding using the electrotherapeutic modalities. But we use the modalities for pain relief only in the acute phase for not more than, I think, 5 to 10 days, not more than that. But physiotherapy is more about exercises, getting the form back and getting the movement back. So it is more on the exercises and less on the electrotherapy modalities. We still have patients who come to us and they ask us whether you have this specific machine, and we will be taking the treatment of that specific machine. Otherwise, we really do not want it. So there are patients who still depend upon the machine modality related approach of physiotherapy rather than the exercise related approach.
Yes, and one more thing is I would like to tell audience that आप लोग डायरेक्टली फिजियोथेरेपिस्ट के पास आ सकते हो फॉर ट्रीटमेंट. आपको किसी ऑर्थोपेडिक डॉक्टर के पास जाके देन यू हैव टू यहाँ रिफ़र होने का ज़रूरत नहीं है. सो या एनी न्यूरोलॉजिस्ट के पास जाके. बट द थिंग इज़ इट्स अ कोलैबोरेटिव अप्रोच. दैट्स व्हाट वी ऑलवेज थिंक. बट यू कैन डायरेक्टली कम टू फिजियोथेरेपिस्ट फॉर ट्रीटमेंट. वो सबसे बड़ा मिसकंसेप्शंस रहता है ऑडियंस के बीच में, क्योंकि वी आर नॉट अवेयर. और ये जो आपने प्लेटफॉर्म दिया है, आई थिंक वी आर एबल टू मेक देम अवेयर अबाउट दिस. यस.
Another misconception what patients usually have is after going to a physiotherapist, the treatment is longer. So what's the point? Let us go to the orthopedic or any physician and get the medicines and get treated within 5 to 7 days. But conditions like back pain, neck pain, or sciatica, like which is called a layman term mein sciatica. So which these conditions which will be treated much better with physiotherapy rather than any medications. So though the treatment is longer, why physiotherapy? Because we are not using anything externally. We are using your own muscles. We are using your own body pain receptors and working on that and getting you back. So nothing external, that is the reason maybe we take a little bit longer time, but it is going to be fruitful at the end.
So I think this was very important session. Like we are getting to know that we are building ourselves with our own bodies, like own muscles and everything. So it was lovely talking to you. I guess the audience would be so cleared with all the concepts of physiotherapy and everything that is involved. Now they'll be very much clear that without medication there is solution to everything. So yeah, it was lovely talking to you.
Thank you so much. Thank you for having us.
Thank you very much.
Thank you, sir. Thank you, ma'am. So today's information was superb. So here हम हमारा वाइट कोट टॉक एंड करते हैं. पर 25 और 26 नवंबर को यहाँ पे पूना में पहला इंटरनेशनल सीपी समिट होने वाला है. सो प्लीज़ चेक द डिस्क्रिप्शन फॉर दैट. एंड हमारे ब्रांच के मेंबरशिप के लिए भी डिस्क्रिप्शन चेक कीजिए. एंड सो फॉलो अस एंड लाइक अस. थैंक यू.